Good afternoon, and thank you for joining today's webinar, Harnessing Public Health and Human Services Systems to Create an Equitable and Resilient Nation, co-hosted by the National Academy of Public Administration and the American Public Human Services Association. Before we start, we're going to go over a few logistics for today's webinar. First off, I want to let everybody know that attendees are automatically muted when joining the webinar. You can use the Q&A button at the bottom of your screen to ask any questions that you have during the webinar. As well, I want to flag for everybody that this webinar is being recorded, and a copy of the event will be shared to everybody via email after today's webinar. Q&As will be responded to at the end of today's session after we go through our roundtable discussion. So with that, I'm going to turn it over to Terry Gurdon, President and CEO of the National Academy of Public Administration, for some opening remarks.
Well, good afternoon, everyone. I am really delighted to welcome you to what promises to be a great conversation today, co-hosted by the National Academy of Public Administration and the American Public Human Services Association. Today marks the first of what we expect to be several conversations where we will look into ways that we can leverage the current public human services system in America to help us address systemic issues of social and racial equity. But before we get into the discussion, I want to give you a little background. In November of 2019, NAPA identified 12 grand challenges in public administration. We wanted to name the big issues of our time, creating a decade-long work agenda, and we specifically wanted to focus on what public administrators can do to address them. So when you check out the list on our website, you'll see topics like create modern water systems for safe and sustainable use, connect individuals to meaningful work, make government AI ready, and build resilient communities on the list. We believe that the levers of progress on each of these grand challenges are firmly in the hands of public administrators at every level of government. And those levers include laws and regulations, budgets, processes and procedures, citizen engagement and public governance, grants and performance measures. All of the grand challenges are interrelated, but perhaps none is more central than the grand challenge to foster social equity. Social equity is one of the pillars of public administration, along with economy, efficiency, and effectiveness. And NAPA has a standing panel of fellows that focus on social equity and governance. But last year, the Academy, like the country, saw plainly through the impacts of the coronavirus pandemic and the protests for racial justice across the country, both how poorly we've addressed systemic issues of equity, but how urgently we need to address them. Government programs that provide what we know as public human services are inefficient by their very design. Historically, they've been stovepiped in funding and in management and measurement, and too often they're focused on outputs and not outcomes. And we know these design flaws have far too often had a disproportionate and cumulative impact on communities of color. So we hope this series of conversations enables a new way of thinking about human services that acknowledges and identifies inequities, examines where and why they exist, and shows a path forward so that leaders at all levels of government can work in coordination with their communities to reshape these critical services so that they deliver fair and equitable outcomes in the future. This is a vital role for public administrators, and I want to thank you for joining us on this journey. And now I am delighted to turn the program over to Tracy Waring-Evans, a fellow of our Academy and President and CEO of the American Public Human Services Association. Tracy?
Well, thanks so much, Terry, for providing that opening context. And it's just been an honor to partner with you on this kickoff webinar for the series. And we're certainly excited to have such a great blend of federal, state, local, academia, philanthropy, community-based, and private partners with us today on this webinar. So hi, everyone. I'm Tracy Waring-Evans, President and CEO of the American Public Human Services Association, and I'll be moderating our session today with our distinguished panelists. As Terry so aptly noted, to build communities where we all have the opportunity to live our fullest lives, we must tackle disparities and inequities at the very root. looking intentionally at policies, people, and delivery systems that form the brick and mortar to building equitable opportunities. And for those of us working in human services, we know the pivotal role that human services system should and must play. Human services provide access to quality childcare, education, and healthcare. They assure food and housing security. They promote opportunities to earn family-sustaining wages and accumulate savings. They connect people to support systems that reduce our stress, and so much more. In short, human services are a critical part of our core infrastructure. At APHSA, we refer to human services as the cornerstone to creating healthy, equitable, and resilient communities. We believe that public leaders working alongside our community and private partners can harness human services to work synergistically with our broader health and economic infrastructure so that all communities can thrive. And to do so, we know we must lay new tracks that connect generations of families, especially among Black, Brown, and Indigenous Americans, to opportunities that increase intergenerational mobility and rates of upward mobility. Our call to action at APHSA to advance race equity, like NAPA's Social Equity Grand Challenge, must be infused in all we do. And I'll share up front that our focus on advancing race equity is not to the exclusion of other groups that have been harmed, but because we believe by first illuminating structural root causes of race inequity within the context of human services, we can drive broader inoculating changes for other structural inequities, such as socioeconomic status, disabilities, gender identity, and sexual orientation. So we hope with all of you over the next hour or so, we'll explore what it takes to do this from the experience and perspectives of three amazing leaders. We're going to take it in three parts, taking first a look back at what has got us to today, a little bit of a historical perspective, then take a deeper dive into the real-time lessons from the past year and the impact of COVID-19. And finally, we'll look ahead to opportunities on the horizon and what can be. We're going to focus on how federal and state policy is being translated into solutions on the ground to tackle the most pressing social and economic needs of families. And we're going to explore what's needed for our human services systems to become more proactive in preventing issues before they happen and helping families succeed for the long term. So I encourage you, as Matt did at the beginning of the webinar, to capture your questions along the way. You can put them in the Q&A function at any time. We have built in time for us to come back for audience Q&A at the end of the session. So please capture those and don't lose them. So I'm going to get us started and introduce our panel. We have with us Duke Storen, who's the Commissioner of the Virginia Department of Social Services. Duke also happens to chair APHSA's Leadership Council and serves on our board of directors, and for that we're very grateful. Antonia Jimenez is the Director of Los Angeles County Department of Public Social Services. Antonia is a leading voice in innovation of human services and a member of our local council. She also serves on the Leadership Council with Duke. And Jody Sanford is the Dean of the Evans School of Public Policy and Governance at the University of Washington and a NAPA Fellow, as Terry mentioned. I've had the honor of getting to know and work alongside Jody during her previous tenure at the Humphrey School of Public Affairs at the University of Minnesota. She's a steward of whole family approaches that keep equity at the center of our collective work, as you'll soon hear. So I'm going to turn us to a conversation about how we got to today, and I'll start with a bit of a meta look, but I'll ask this question of all three of our panelists. And as we think about coming together today and the challenges that our nation faces, we know that some of these are new, but many have evolved over decades and even centuries in the making. Learning from our past and understanding how it influences our present, I'd like to hear from each of you about what are some of the most critical, long-standing issues that human service agencies can impact through a policy agenda focused on promoting a more just and equitable society. And Jody, I'll kick it off to you.
Thanks, Tracy. I'm grateful to be here and joining everyone. You know, this question about root causes to me is essential to start with. And, you know, when we teach graduate students in this space, we always talk about the fact that our country kind of built a system based on two kinds of people, deserving poor and undeserving poor. And that means we have created really an institutionalized patchwork system for the people that were deemed not worthy. And I think people in our system of human services have had to deal with that legacy and really try to make the best of some fundamental principles that deemed certain people not as legitimate to getting equitable treatment by human services. And what I think is this moment is to deal with that legacy, look at the racial bias in our system, look at the other kinds of biases that are kind of baked in. And there's no more important time to do it, right? So the economists will tell us that we have not been at such a time of income inequality in more than a century. And we've learned a lot about the consequences of this system on people's lives. So I do a lot of work in the space for looking at how the bureaucracy functions. And we know that people learn from their encounters with the public administrative system. They learn about being excluded. They learn about being second-class citizens. And in fact, there's a whole area of work that's been developed around understanding the consequences of administrative burden. And that people have to disproportionately learn, how do they navigate these systems we've created? How do they comply with the rules and their incredible psychological and social costs? So I think the federal government at this moment in time must partner with state and local government to really modernize the system. This means investing in basic IT infrastructure. It means supporting human-centered redesign of services and programs, and really building out the capability to deliver on an equity promise rather than just being accountable. Because I think we've built a system that's really focused only on accountability rather than as much as we need to address this legacy from the past.
Thanks a lot, Jody. Very helpful. Duke, let's go to you from you've obviously served in multiple perspectives, but from a state perspective.
Thanks, Tracy. Yeah, I mean, I would like to build a little bit on what Jody said. You know, I think we have created a patchwork system of income support and other types of support programs, nutrition, housing, access to healthcare. And, you know, at the bottom of all of them, when looking at the outcomes we seek, is the experience of poverty that we have. And I think if we are going to be intentional about addressing structural inequities, we've got to keep poverty square in the focus of the solutions that we want to create. I mean, we've got multi-generational poverty. You know, Raj Chetty's work shows that the neighborhoods in which people live really impact their life outcomes. And some have very little intergenerational mobility, if any. And I think any federal response from a policy standpoint that takes an equity lens, we're going to have to be willing to invest disproportionately in neighborhoods and in individuals that are at higher concentrations of poverty. And I think the other side of, or the other impact of poverty that has been a long-standing challenge for state and local human service systems really is food and nutrition insecurity. You know, we've only had the measure around since 1995, but we know that hunger has been a persistent problem in our nation's history, and we know it disproportionately impacts Black and Brown families. And we have created structures that are not improving our food security system. So we need some bold federal leadership to do something different than the patchwork of nutrition programs that we have today. I think if we can tackle poverty and be less paternalistic and address food and nutrition insecurity, some of the other longstanding human service challenges will dramatically improve: health outcomes, school readiness, school success, to name a couple. Thank you.
Thanks, Duke. Antonia?
Sure. I want to start by just echoing what Jody said, because I feel like the health and human service systems are for the poorest of the poor and not even for the working poor. Because the amount, like if you get $1 minimum wage increase, you might be able to lose a lot of your benefits, but you're still not a family that's stabilized and that has the ability to maintain themselves. So I think government at all levels needs to focus less on the specific rules, look at people holistically. What are the issues and the challenges that families are having? What are the impediments for helping families become more economically and financially stable? And when we look at the system across the board, they're so siloed that you can run your program, but you have no impact what running your program has on another program. And when we look at food insecurity, which is one of the things that Duke mentioned, it's important to notice that, we have to applaud the federal government during this pandemic, because not only did they increase the emergency allotments for depending on family size, they're going to have a 15% increase in benefits, but they're also working on students. But it took this pandemic to realize that, we've all known we had a food insecurity issue, and we talk about it, but we don't do anything about it. And so I think that now that we've done all of these changes, we have to make sure we don't lose and the progress that we made, and that we actually build on the momentum that we have, and that we don't step back after to the pre-pandemic days. So I would say that families need to be looked at holistically. We need to look at programs across the board, and we need to make sure that we understand the true needs of the family and that we hear from them. We think we know, we might not know. And so it's a voice to bring the communities into the decision-making process so that they can tell us exactly what they need so that we can help them.
Thanks, Antonia. That's super helpful. And I think building on what all three of you said, really centering people and family, their expertise of what they need, and how do we create our systems, right, to advance that interconnected place with where anyone lives their lives, right? So we often talk about social determinants of health and well-being, and yet we haven't really centered our systems to recognize that. And I think building on all of your comments, and I'll ask this question of Duke, as we think about how pervasive the intergenerational wealth gap in housing and all of the pieces you spoke about with respect to poverty are among communities of color. You shared some ideas around kind of federal policy and what we can do to counteract these longstanding inequities, but you want to go a little bit deeper, and then also maybe speak a little bit to the leadership roles that are required across levels of government to achieve that.
Sure, Tracy. Thank you. Yeah, I do think federal policy has come up short. And I'll give you a nice litany of examples. One is the minimum wage, which hasn't kept pace with inflation, which has significantly hurt low-income workers and continues to drive the wedge of income inequality. The failure to expand the EITC to make more families eligible, expand the child tax credit. Not updating the Thrifty Food Plan. When I used to work at USDA, we couldn't talk about taking then it was the food stamp, now the SNAP challenge, where someone actually tried to live, even though it's supposed to be supplemental, tried to live on the allotment, which is almost impossible. Not updating an alternative measure of poverty. Our measure of poverty does not account for the true cost of living in communities. It should vary by locality, and there's a lot of alternatives out there, and there's no reason that we can't have a true assessment of whether or not people can meet their basic human needs and live a life of dignity. I think the TANF time limit and focused on work first, and the use of the participation rate calculation and caseload reduction credit is really a failure. TANF has not been a success. The reduction in rolls are because states haven't increased the income threshold not because people are better off earning a living wage. Not making the nutrition program supporting seniors as entitlements like they are for child nutrition. So we have a growing senior population, and we have capped funding for congregate meals and home delivered meals. It's a complete ostrich approach to public policy for seniors, where we stick our head in the sand and pretend like nothing is wrong. A lack of flexibility in the allowable uses of administrative dollars across these different programs. Antonio talked about how the interaction between programs is really difficult for families to mediate. We need to take a whole family approach, but we need the flexibility to make that happen, to make joint investments in systems and in people that foster collaboration. And I think, the benefit cliff is real. We have evaluated, we have demonstrated, we have graphed it for years. Time to do something about the benefit cliff, not just tell people that it's out there and counsel them about what's going to happen when they earn a higher wage. So, I think at this time, the type of leadership we need is leaders who are willing to foster innovation and recognize that equity is very different than equality. And they have to be willing to invest in people and communities in different ways based on need. In the 1990s, the federal government pushed innovation using the demonstration and waiver authority. And 1115 of the Social Security Act is still around. And it's not just about Medicaid and Medicaid work requirements. It impacts all of the programs. And then the Food and Nutrition Act for SNAP has similar authority. So we got PRORA, Personal Responsibility and Work Opportunity Reconciliation Act, and the Workforce Investment Act, and other landmark legislation coming out of some of those experiments in states. I think we need that level of bold innovation focused on equity and a willingness of our federal partners to try something new. Because if we just keep operating the programs the way we are, we're not going to achieve our objectives. Thanks.
Thank you, Duke. That was a really impressive and comprehensive, although I'm sure we could add to it, list. And so I will give Antonio or Jody anything you want to add that was sparked by that comment from Duke.
I do want to add the administrative complexity across all programs. So healthcare is a right, so you only have to do your renewals once a year. But food doesn't seem to be a right. And food, you have to constantly do your semi-annual renewals every 6 months to demonstrate that you still are eligible to receive these benefits. And I think that, the food insecurity should demonstrate to us that all of these administrators that we put on, all of these administrative burdens that we put on families are not really helping us with the food insecurity. And we should look at the programs across the board because we're asking the same families to provide all of this paperwork and all of this renewals time and time again. I really don't understand, and it's a burden for them to maintain and keep going. And these are working families who are getting dollars, and they don't want to have to miss a day of work because they failed to submit a documentation that the federal government requires. So I think we just have to look at it holistically.
Thanks a lot, Antonia. So Jody, I'll let you chime in if you've got additional pieces, but I'll also ask you the next question, and that way you can combine them if you want to. So just shifting, still kind of thinking about where we've been, right? Moving to practice, and considering that we want to promote a system that is truly inclusive and effective and equitable. We know that those human services policies, as Antonia just really said so well, must be anchored in human-centered and culturally appropriate practices that are informed by the lived expertise of our people serving systems. And so I think from where you sit, how are human service agencies evolving in the way they deliver services and supports to reflect this? And what challenges must we confront in both the top management and front lines of staff in doing that?
I love these questions because I focus my work in policy implementation, and we have created this massive complexity that you can't implement. if I was sitting in the federal government, one of the things I would just want to say in reaction to this question is you have to appreciate how people have been trying to make this patchwork system work. If I think about how many philanthropic investments have been invested in things like simulations so that middle-class people can try to navigate the poverty infrastructure, with this amount of money and this amount of public benefit. People go through these things through churches, through community groups, and they get shocked and they get stunned, but then there's been no policy change, right? And so Antonia is talking about, and Tracy, you said as well, grounding this in family need. We know how to do that with human-centered design and backward mapping practices. And yet we have created a system where the people who are most knowledgeable at trying to center family needs are the frontline staff. And those are the people that we take so much attention to controlling their discretion and not rewarding their whole family orientation, right? It's created in many people that their mindset is just to implement one of the programs, following the in a regulatory compliance way. And the workers who don't do that, managers know are doing wonderful work, but they always feel like they're working outside of their job. And so what if we centered people who do work that keep the needs of whole families and are able to find those resources to support them? So some things that are evolving and I think have been really promising, one of them is actually work that APHSA has done around articulating the human-centered value curve. It's a simple tool. It's a heuristic. We've taught it for the last few years in graduate school because it just helps people say, these visions are a big thing, but how do you move systems from a regulatory to a collaborative, to an integrative, to a generative kind of business model? That language and clarity about what we mean operationally is a really important advance. I also think that this council that Antonia's been connected to, which are the local program administrators and leaders from across the state, they show how they try to make new policy programs that are keeping whole families. They're trying to innovate, but what I've seen is that the resources to support that leadership are really scarce. And the waivers to allow them to innovate on whole families are really scarce. So we need to leverage local governments to be learning labs and really allow them to do what they want to do for families rather than being accountable to these outdated systems. And then finally, I think policy, as I said, directs people, and Duke said this as well, to be expert in something very, very narrow. We need to support the new practice models that are developing that overcome this kind of categorical thinking and really allow people to do what they want to do. It's why they went into this field, but the current system inhibits them from doing that.
Thanks a lot, Jody. And I noticed in the chat, I think the points really around, and I know we all probably feel like we're talking to the choir with each other around this, but the points really around whole family approach and centering family, and recognizing that our conversations about it haven't yet impacted in the ways we want to is, I think, resonating with the audience. And so certainly we can maybe dig a little bit deeper into that as we think about when we get to the points of looking ahead, how do we really do that? But let's turn now to kind of the here and now, or the experience of the last year in a global pandemic that I think there's lots of conversation we can have around it, but let's kind of center that in specifically and how much it has revealed what so many folks in the human services and human serving systems knew, that structural inequities have been, embedded in our systems. They manifest themselves even more in illuminated ways in a crisis. And when we think about the disproportionate health and economic impacts of the pandemic, we Also know that it's not just in the immediate here and now. Many of those families are first affected and also last to recover. And so I'd like to hear, Antonia, from your perspective about the ways in which you see human services playing a pivotal role in both mitigating the disparate impact of the pandemic right now and promoting an equitable recovery, and maybe sharing some of your own experiences there in LA.
So I always say never waste a crisis. Taking this opportunity to really redesign our business model, using the technology that we have in hand to make sure that customers can call us from wherever they are and apply for benefits. And we're about to launch our March 8th, the same thing for renewals. So that people don't have to worry about, they can just call us and renew. So we're fixing our business models to make it easier for families to get the benefits that they deserve. But I also think we need to look at it from, and I like what Duke said on the benefit cliff, because a family of 4 in TANF in California, once they make over $2,450, they're off the TANF rolls, and $1,800 or $2,000 of that goes to pay rent. So it doesn't mean that they're going to be able to survive. And so we're looking at ways in that we can have some flexibility in the funding that we have to make sure that we're putting the supports around the families, so that we can even blend funding from the homeless dollars and the TANF dollars, and making sure they get the maximum they get on the CalFresh. But I think that we need to continue to push the envelope. We can get the operational business processes right, but just because it's quicker and easier to get benefits doesn't mean it's getting you the benefits that you really need in order to make sure your family is stable. So that's kind of the direction that we're looking at. How can we be flexible in how we use our dollars to families have the supports that they need?
Thanks. That's really helpful to hear the on the ground experience and the ways in which you're thinking about moving forward, Antonia. Duke or Jody, anything you want to add on that point, or even to the point of how we are translating what the federal response has been into action on the ground?
I guess Duke has probably some insight on here. I just want to frame for people. Antonia and Duke are talking about more flexibility. Sometimes people have felt like, of course, that's what you would expect state and local leaders to say. I think I want to make sure the federal people understand that the reason why this is a solution goes back to what Duke was saying earlier. We need innovation so that we can see what works for systems redesign. It's not something we can do from the top down. We must do it from the bottom up, given the nature of this particular policy area, where so much of what's important happens at the front line level. And that's obviously significantly influenced by what Antonia is saying, the management infrastructures they can create there.
Thanks, Jody. Anything you want to add, Duke?
No, thank you.
So let's.
I do want to add that management flexibility and how to use your resources doesn't translate to asking for more federal dollars. And I think that sometimes when you say management flexibility and how you use your resources, all people hear is, oh, they want more money. And I don't think so. I think there's a significant amount of money. We just need the flexibility on how to use it. Less compliance, less regulatory, less checking the box that you gave the same dollar to the right person, and that you have all of these administrative burdens that actually eliminate the possibility of you being flexible and you being creative, because you're going to come down and you're going to get an audit that you're not complying with some, rule that was established in the 1920s. And so, I think we just have to get beyond that point.
Thanks, Antonia. That's a really important additive contribution to Jody's frame there. So, Duke, when you think about what you've seen as some of the successes of the human services system being responsive in this pandemic and its in its holistic way, including its economic repercussions. Maybe share some of your reflections and also the ways in which we can, in partnership with the federal government, continue to accelerate that equitable recovery that we want to see.
Yeah, I mean, I think some of the most effective responses really did address the economic insecurity head on. We had the expansion, extension, and supplementation of unemployment insurance. We had direct cash assistance for families through the CARES grants. We really tried to tackle food insecurity by making meals free for all students, for finally getting rid of the stigma of school and after school meals and summer meals through the pandemic EBT. And we really addressed some of the natural disadvantages that households whose parents have to physically go to work during the pandemic, right? Who weren't working from home and who lack adequate transportation through pandemic EBT. I thought the increase in SNAP allotments and the 15% increase under the Biden administration were really efficient, both to help households as well as the economy. Under the American Recovery and Reinvestment Act, they increased SNAP allotments by 13%, and they found that it was the most efficient stimulus for the economy, in addition to dramatically increasing food security. I think allowing virtual visits as part of the child welfare system was a really smart flexibility, and one that I hope we can carry with us moving forward. And then I think the investment in childcare has done a number of things. One is it put a spotlight on a very fragile, broken system to begin with. Everyone finally woke up and said, we can't treat people in the hospital unless they can drop their kids off at childcare. And so we had this huge both focus and investment. And I think those flexible pots of funds help providers, direct investment to providers in most states. And those are women and minority-owned businesses. At least in Virginia, they are predominantly, as well as helping, participants by waiving copays, extending absence days. And in addition to investment and flexibility, I really thought the federal government did a great job preventing some bad things from happening, right? It put a moratorium on evictions. I mean, I think this also shows a spotlight on the challenges we have for people day to day in making their housing payments and the fragility of the low-income housing system. So as we sort of turn to the future, based on some of the experience that we've had in terms of success in the last 11 months, I hope that we allow summer EBT as a standing option for the summer food service program. Right now, it is not an option. And I hope that we continue with policies that make school and other child nutrition meals more universal and get rid of some of that stigma. I think we are seeing the power of increased SNAP benefits in staving off food insecurity and hunger, and then all of the benefits that has around school readiness and healthy workers in the workforce, et cetera. I think it really speaks to we need a permanent change to increase in the SNAP allotments. I think as we look at maybe the next stimulus bill and future investments in childcare funding, I think providing either a requirement or an incentive to stand up a more supply of childcare in underserved communities, or for household compositions that are underserved, people who work the night shift or infant and toddler care. And I think we should really be thinking seriously in the recovery about what we can do to shore up our labor market to make sure that the recovery isn't just for the middle and upper class like it was after the Great Recession, that it's for all of our workers. We were all, focused on AI and bots taking away all the low-wage jobs, before the pandemic. And so we kind of put that on the shelf, but that reality is still before us and perhaps even accelerated as we've relied more on automation. So looking at a public jobs program and at very least leveraging our patchwork of workforce to really focus on the things that we need as a society: infrastructure, including broadband, green economy jobs, food security, and transportation. Thank you.
Thanks.
I just want to,
Go ahead, Jody.
I want to echo this because I think this principle of recovery for all workers will do so much. I also think when Duke's laying out all these detailed program pieces, to me, it's exciting because 1 year ago, we would never have believed that the federal or state government would remove those kinds of administrative requirements. And they did it because they were focusing on outcomes. What are the outcomes we needed? And it moved fast, which is, as somebody who's been in this field for 25 years, it's exciting because we have never been able to move, and we've been able to change and get some of the crap out of the way so people can do their jobs. We need to keep that attitude going forward and focus on the outcomes we need for citizens.
Thanks, Jody. Antonia, certainly build on that, and maybe also just share a little bit about what this has meant for adaptations in practice. You talked a bit about we can make the business adjustments on the ground, but maybe make that come alive a little bit for folks about like what that's entailed and how you've done it.
Well, I think the first thing I did during the pandemic is just give people access. Access was a big deal. And, the offices were technically not open to the public, although we kept some of our offices always open and we continue to do that. But just giving people, like for the first time, we saw an 80% increase in our SNAP program. And that was interesting because it was the first time that I think even the middle class who lost their jobs understood the importance of these programs because they had to apply and they've never had to apply before. So when you're able to live in somebody else's shoes, and you have a better understanding of why these programs are so important. I think that also when we look at the homeless population here in LA and the housing costs, we can't just say it's all about the benefits. It's really all about how do you get someone to get the right level of job, to get the right training, the right supports in order for them to be able to even afford housing. So I love the moratorium. I thought that was important. We don't need to put more people out on the homeless streets. But I also think that when we look at families as a whole, they have other issues that, that most of these are working families, 2 adult families or a single adult that's working and have to put food on the table, make sure the kids go to school, make sure that they're able to pay for their rent. And so we're looking at, for the people that we can just through our business process, just give them the benefits that they need because that's all they need, then we'll do this business process redesign. For the people that need more supports, then we really want to put all the wraparound services, help them with housing, help them with food, help them with domestic violence, substance abuse, all of the other support services that are so critical needed to stabilize these families. And, mental health is a big issue that we have to address. If it was a bigger issue before, it's now even bigger with the stress that people have of, going to work and are they going to be safe and are they, and where do they go when they get the COVID? And so we're really focused on really what does the family need? Just what do they need and how can we get it to them? Regardless of the regulations, regardless of the policy. Of course, we don't want to break any rules, but how do we use the funding to make sure that we provide holistic services to our families? Because most of these families are Black and brown families that, even tutoring. We started a student tutoring program for our TANF population because parents are sending their kids to virtual schools, but these parents don't have the education in order to help out. So it's even those little things when I talk about families, that's what I mean. Like what supports do they really need in order to stabilize their environment?
Thanks a lot, Antonia. So I'm going to take the direction now a little bit to thinking out to, and you've already done this because this is how you all are leaning in as leaders, but really to the future, right? What could be and what is the moment mean now to taking us there? And we've talked a bit about the intersection of some policy issues that maybe traditionally we didn't think of as connected, or maybe we did, but we haven't acted as in that way, like how human services intersects with education policy, or how human services intersects with tax policy, two issues that that Duke has raised. And so I just wanted to offer up if anybody wants to add any other sectors or important pieces you want to lift up about how policies work in tandem with each other across sectors and systems that we need to keep in the forefront if we're really to have an equitable recovery. And I'll just open this one up to anybody who wants to add anything on that point. You guys are all good?
Tracy, this is Duke. Just kind of a comment about, you had mentioned, and I had talked a little bit about some tax policies before. One of the things we're doing in a couple of our local Department of Social Services is we're trying to integrate tax preparation as a core service that we provide. You can file your taxes anytime, not just tax season, and you can go back for EITC for multiple years. And so doing that screening on whether or not people have filed in the past, and then offering that, 11 months ago, we had offered it on site. Now we're trying to offer it virtually. And then I think even if we're not integrating it into our business processes, being very intentional about outreach. So we do a match with our state tax files to see who filed for EITC, and we know everybody's income and household status as the cognizant agency over all the income support programs, and then testing different outreach strategies. We did an RCT this year using texting outreach strategies. So I think, and then the other side of that is how to utilize a refund. Can we really rethink what we're doing with individual development accounts? Can we match savings or match expenditures on key investments that help people rise out of poverty through education or asset creation or other strategies? And then, the other is, really ensuring that there's affordable access to dependent care services. So if it's one thing to be eligible for a credit, but if you don't have access to those services, and that's the health and human service responsibility. And I know that a lot of those services are not available and not affordable to low-income families. So just a little intersection there on the tax side that you mentioned.
I want to jump in because the research is really clear on the tax policies. The Earned Income Tax Credit is the most effective anti-poverty program we have ever passed in this country. And the irony is it hasn't been administered through the Health and Human Services system. And so what Duke is talking about is a key leadership framework, right, of integration. He's saying, well, that hasn't been in my swim lane, but I know the policy is making a huge difference in people's lives. How do we decrease barriers to access? Because right now, if you don't know how to fill out your taxes, you're going to these voluntary tax preparation sites, and they vary tremendously around the country in terms of how well they're resourced. And so for people in the public sector to do what Duke's talking about, which is to think holistically, try to integrate across the boxes that are how people have defined your job, and really bring resources together. That's the kind of leadership we need to really take advantage of the policies that have been creating the outcomes that we want.
But I'll add to that, because I think that I go back to the program connections, right? Because I heard that the federal government was thinking on the Earned Income Tax Credit for a family with 2 kids to give them $3,600 lump sum and then the rest in $300 on a monthly basis. Well, then those $300 on a monthly basis, guess what? it counts as earned income. And so earned income might cancel some of the programs that you currently are eligible for. So when I say look at it holistically, I mean, like, this might be great earned income tax credit that's going up, but if we don't look at the implications that it has on other programs, I feel like we're just like swimming without really having a course for which we look at through these lenses and make sure that we're moving towards the right pathway. So really the integration of programs, I've learned the hard way in LA, is really important, because a minimum wage can cancel 10,000 families for $1, 10,000 families in SNAP, right? If we go through this earned income tax, we might lose families in TANF. And so the integration of programs is becoming, to me, becoming a more and more important issue that we just can't ignore. We really have to make sure that one program doesn't cancel another.
Yeah, and I think your point there, Antonia, on really understanding the unintended consequences has to be, at the front and center of how we're thinking about policy pieces. And certainly, as I think something that was in the chat earlier around really the critical importance about asset building, right? So you can't build assets if you have a benefit cliff consistently keeping you from really achieving either higher income, but then let alone creating kind of the asset and closing that wealth gap. And so I think those are overarching principles that I think we're trying hard at APHSA to bring to the forefront of. These are the kind of considerations we have to put front and center as we're thinking through the policies and really what is an opportunity to bridge with openings that have really the pandemic has created for us to be tackling and really dismantling some of those inequities and moving ahead. So I'm going to ask a last question around kind of embedding equity in everything we do to all of you, and then we'll open it up for questions from the audience. So again, for those of you who are listening in, please feel free to put questions in the Q&A section, and if you happen to capture them in the chat, we'll get those too. But let me ask this question, and I'll start maybe again, Jody, with you, and then move kind of from your big macro observations to Duke, and then Antonia. And really the question is this: both NAPA and APHSA have embraced and are trying very hard in our intentional work, this call to action for the public sector to do the work that's necessary to essentially rewire our systems to promote equity in everything we do. And I think it would be helpful for everyone to hear from your vantage points, what are the steps needed for local, state, and federal partners to work together to instill equitable policies and practices as our default, right? The way of doing business. And we know this is going to require that we build more muscle around rules and processes and norms to make it a reality. And I think it would be really helpful from your experiences for you to give some reflections to the group on that. So I'll start with you, Jody.
Yeah, I'm really glad you asked this question. I've been having a lot of conversations with friends of mine, particularly those who are African American, who really fear that all this attention to equity is going to fade. And I think given the legacy of white people running systems in this country, there's fear that's a legitimate fear. I think this is lifetime work. The former president, as people may recall, was trying to shut down the training around anti-racism and intersectionality in higher education in every government contractor. And in that announcement, he said, well, this is un-American. And as an adult educator, I took a lot of, that made me very angry. But when I thought about it more, I realized actually it is a little anti-American. We have not done a good job in this country in the past in really owning, naming, and making a commitment to undoing the legacy of slavery and mass extermination that white people have led in this country. And so I think the moment is now to change that history, to live up to our espoused values. And as Duke said, equity is not the same as equality. So if we have an espoused value in dealing with the social inequity in the society, that work has to be done on multiple levels. It has to be done individually. White people need to understand the world, the water we're swimming in, and that we've always been swimming in. We need to do our work interpersonally and understand the different experiences of people who are unlike you or your family. We need to, in the roles we all play, deal with the organizational white supremacy that's embedded in operations and practices. Everything from who do you contract with, to who are the vendors that you get your catering from, to what are your HR practices, and then the institutional and the policy levels as well. So we're all going to be trying to do things that have never been done before, but it's about shifting power. And I really feel strongly that the future of the country, of democracy, depends on us dealing with this for once and for all. And it's going to take the rest of our lives to make progress, because it's been a long time in the institutions and the way we work.
Thanks, Jody. Duke?
So I think about it in sort of three very clear steps: identification, understanding, and acting. So I think as leaders at all levels, we have to commit to doing the data analysis that shows us where we have equity issues, and then set targets for improvement and be very transparent and hold ourselves accountable and hold one another accountable. I think that includes our service outcomes and outputs. That includes pay scale with our own organizations and those with whom we contract, and then in communities and states as a whole. And it gets into things like contracts and funding formulas. So I think we need a real commitment for that ongoing data analysis. And then I think we've got to listen more. There's a lot of opportunities to do that, and they're all important to embrace, from interpersonal relationships to observation in communities and how we deliver services, to focus groups, advisory committees. Human-centered design is about listening first, and we've got to commit to that as a core principle in how we do our business and a core value for our organizations. And then a focus on organizational culture, being really intentional about equity, but also about diversity and inclusion. I think they are all different, but doing a good job with diversity and inclusion will help you do a better job with equity. Embed DEI goals and strategies into your organization's strategic plan. Lift them up, make them important, talk about them, be accountable. And then sort of that ongoing training, education, dialogue opportunities, and really fostering this not as a singular top-down initiative. It is not about having a committee. It's about the way we go about doing our work and interacting as human beings. And finally, there's nothing like concrete action. The very first thing that we decided to tackle was doing a pay equity analysis, so we could demonstrate to our team that we're taking this seriously. And the second thing is our funding formula to local departments of social services. There's nothing like money to get people's attention and to reflect the values of an organization. And then sort of looking beyond our bureaucracy, really thinking about prioritizing and investing in people and communities early. So that prenatal through 5, I think, really has the best return on investment. And so putting an equity lens on our outcomes and outputs, prenatal through 5, and focusing on those systems first. So we did, a series of listening sessions, hunger town halls, sessions on maternal and child health around the Commonwealth over the last couple of years. And we're coming out, I'm proud to say, with a doula benefit in our Medicaid program. And we're ensuring that every community has a hunger action coalition that's maximizing the opportunities to address systemic issues in food insecurity. Just a couple examples. And finally, in the policy making, building an equity assessment into the policy process. And APHSA did this, and Anne and Matt and Tracy, and I've really seen the power of being intentional about that. And so we're building an equity analysis into our policymaking process to help build, like Jody said, to build systemically for the future and not have this be a one-time effort. Thank you.
Thanks, Duke. Antonia?
Sure. I also, when I think about the diversity and inclusion from the program and then from the staff, they're two different things. But from the program, I really look at, we have an immigration issue. People are afraid to apply for benefits because of the impact of immigration. Some of it's real, some of it is a myth. And so we're trying to spend some time here to educate our customers of what's real and what's not real. And then we have a diverse community here in LA. And so the way that you talk to the African-American community is different than you talk to the Latino community and the Asian community and the Armenian community. So how do you get the message to the right individuals in a way that they can really understand? So cultural is one of the things that we're focusing on. And also the CBOs. I heard somebody say this. CBOs have a role to play. They're the trusted advisors in a lot of these communities. And how do we work with the CBOs and the faith-based organizations who can help us? And the one thing I do want to invest in this year and with our programs is youth. Right? If we can start now with our transition age youth, and it'll help them set them up better when they become adults, and hopefully we can work towards that. And then I'm going to echo what Duke said on the policy changes, that we need to focus on the policy changes that enhance and support families and not maintain them in the lowest. They have to be the poorest of the poor, and not even the working poor have access to these services. We've really got to change that. And then from a workforce, we have employees who struggle with who should deserve these benefits, because they're not making a whole lot of money either. And so they're figuring they're giving all of these programs to these families when they have to come to work. And so we have some cultural shifts to do in our department as well to make sure that people understand. And one of the struggles that we were having is during the pandemic is that the eligibility workers were not seeing themselves as doing eligibility work, but doing paperwork because the client wasn't in front of them. And you have to remind them that every application you process is a family or an individual that's being served. And so that has been one of the things we're working on here, because we want to make sure that we don't lose the empathy that our workforce needs in order to continue to support our families. So we have a double struggle going on, and we're going to continue to work towards that.
Thanks, Antonia. Thanks to all of you. Those were, I think, really helpful, both reflections, but really starting to graph a way forward in this work. And one of the questions we did get was around talking more about that connection with community-based organizations that Antonia just mentioned. And I'll just add that I think it is core to centering family, that you're centering family in place with trusted organizations and community based places that are really trusted agents of the delivery systems that we all provide. We often talk as a monolith of public sector human services, as if it exists in just the agencies, and we all who work in the space know it is not, right? We rely on many organizations and other in businesses as well, right? Private sector and community-based sector to really make it work. And I think part of the systems work really has to be the intentionality around that, and how do we do it in a way that's going to be most effective. But I did have another question that's aligned to the community-based organizations that came through in the registrations, which was around the role of the faith community in creating a resilient and equitable nation. And so I didn't know if anybody wanted to add anything on community-based organizations or the role of the faith community in the work you're doing.
I'll jump in just to say, so this is something that's always been unique about the United States compared to other countries, this robust private sector, nonprofit faith world, right? And that communities here naturally turn to themselves, and we had a system where these organizations could be created, mutual aid and support, and over time those have been institutionalized. I think, to me, one of the important things for people in the public sector to remember is that nonprofit organizations are not really contractors. And in the last 30 years, we've used that language, and we've thought about people who are providing core services similar to the people who you contract to get staples and pens. Procurement of those kinds of things are totally different than engaging with nonprofit organizations. And I think actually the public management rhetoric around competition and just that whole orientation really has decreased the effectiveness of the system. So I just think it's critical that the public sector realize these organizations are partners. As Antonio mentioned, they have legitimacy with families, but they also have deep expertise. And they have a different business model, which means that sometimes they don't like the public sector very much because they feel very beholden to you. And I think the more, like, as Duke was saying, it's about listening. It's about listening to organizations. And again, I will take my hat off to APHSA because under Tracy's leadership, you have made strategic partnerships with other national associations of nonprofit organizations, such as the Alliance for Children and Families. And more of that has to happen because the nonprofit and faith-based organizations are essential in the work of this system. And we've gotten in our own way a lot in how we think about them, I think.
Thanks, that's really helpful. Any other reflections before I move on to the next question from the audience?
The only thing I will add is that we overregulate them too.
Yeah.
Right, with nonprofits, we overregulate CBOs. We make it so difficult for them to provide the service because they have all of this administrative requirements that government puts on them. So we have to work a little bit on that as well.
Yeah, I mean, this is Duke. I do think Antonio's comment about both CBOs and faith-based partners as being trusted spokespersons, no matter how hard I try and how much training, we are still the people that come and take the kids out of your house, and it's hard to overcome, and I think Jody gave a nice sort of reflection, really a history of systemic racism in the public sector. And it's really hard to unwind that. And it's going to take a really long time. And we need trusted voices to communicate the important services. And, in the pandemic, it's been so important. We've had a number of calls, webinars with faith-based organizations, just simple things like, this is 211. Here's our COVID app. Please get your vaccines. Help us carry that message because they're going to believe you more than they're going to believe us. And so, in addition to service delivery, I think that's a really vital role that they provide for us in Virginia.
Thanks, Duke. So one of the other questions we received was, what do you think it will take to finally address the benefits cliff and committing to actual economic security through policy and program design? Big question. Duke, I know you have a comment on this.
Yeah, what time is this webinar over? So I think, the benefit cliff is a function of federal policy. So one of two things have to happen. One, we have to change the federal policies, which looks like changing, combination of changing earned income disregards and aligning the exit criteria to be more akin to a living wage. Or it's, cashing out some of these existing programs and looking at a different model or models through innovation. And I think, but you cannot overcome the benefit cliff without changing the federal rules, because that is what creates it. So.
And I would like to add that we saw during the pandemic that when the federal government wants to move quickly, they can, right? And so I think the benefit cliff and the rebuilding the economy go hand in hand, and that this is an opportunity for maybe us to leverage opportunity, change some of those things that caused the benefit cliff, so that we could have a robust economy, because it is important for all of us, and especially for our families. So I don't want us to let government go back to the snail's pace. I mean, they have the ability, they can move quickly, and we should push this, especially now with the benefit cliff. So I'm working on trying to figure it out here in LA for our families and what policies we need to change. Happy to share. I'm sure you have some, Duke, as well. I think we have to go holistically on this, that the time is right now, if we're going to work on the economy, to look deeply at how to eliminate the benefit cliff.
I would just add, this is a policy issue we have been talking about for 40 years.
Mhm.
The Atlanta Federal Reserve Bank is deep in this work. It's technical and it's totally fixable. And we must act on this at the federal level, because that's where it comes from.
Thanks, Jody. And I was going right where you went, which is there are some really critical partners and economists that are right with us in terms of this is something we have to fix, and it is fixable. And so I think we really need collectively, right, across national organizations and from the ground up, from local, state leaders to really bring this forward. And, part of the conversations and us coming together with NAPA on this webinar was also to really be able to lift up for so many of our federal partners how critical this is, and try to find some pathways forward. So I really appreciate all of your comments on that. I'm going to ask one more question here, and then be sure to leave a little bit of time for Larry Glickman, who's going to come on and just share some reflections about what's next and what we hope to do through NAPA on this series. But I will ask a question that came up about kind of digging a little bit deeper into how can we improve cultural competence in outreach and service provision. And I think Antonia touched upon some aspects of kind of what that looks like in communities, right? Certainly place-based and centered into what a particular community looks like. But any reflections on that about what we need to do, maybe more from an investment standpoint and federal support?
I think it goes back to like the nonprofits can do stuff that government can't. And they have the cultural competency because they work with these communities day in and day out. And I think we have to empower them to help us reach out to our families, and we have to loosen some of our requirements so that they can help families more. So I think that and also we need to educate our staff a little bit, as well as the importance of understanding different cultures and different aspects of families. So I really believe that the area for cultural competency that we need to invest on our CBOs, let's get through some of those issues that we're facing, because they are trusted advisors and we're not, as Duke said.
Yeah, just to build on that, two things. One is, we need to spend more money. I mean, the bottom line is, even something, not even getting to cultural competency, but just having, appropriate languages and having the access to appropriate languages. Language line is not good customer service. it's the last resort, not the first resort, right? So having both staff and materials in multiple languages, it's a difficult investment to make, but it's a small step toward cultural competency. And then I do think that staff training and partner organizations, that's an ongoing body of work. And I think the federal government has a role to play in recognizing the importance of cultural competency when it sets up the standards around evidence-based practices. You know, this has really been clear in the Families First Clearinghouse. Families First is the Prevention Services Act, where you can provide prevention services to a family with a child at risk of entering the foster care system. You know, they've got an evidence base. These big national programs cost a lot of money to evaluate them, but there's none that are, you know, specific to, you know, indigenous populations and other sort of cultures. And I think you can replicate that in the SNAP Ed Clearinghouse and the Department of Labor's Clearinghouse, right? We all want evidence-based practices, but we need to make room in federal policy for adaptations and cultural competency. Thanks.
I just want to echo that. Yay, yay, rah, rah, 100%. There's a reification of a certain kind of evidence that is studying people who look like me. And we have really missed the boat on this from a research perspective. And now policy is following suit. And so we must address that and not get misled to think that that's the only kind of practice that's legitimate. I think that's critical.
Thank you, Jody. Really important point. And important also as we think about what's the synergy and possibility of practitioners alongside our academic and research and evidence partners as well, that, you know, this is something, and I think one of the reasons we wanted to bring NAPA and APHSA together is because NAPA also really has these strong connections among universities and colleges and a lot of institutions that provide critical research support. But we have to be, you know, bridging the divide between the people's experience, practitioners' experience and needs, and what and how we've been thinking about research and really making sure that we're doing that through an equity lens. So I think those are all really important points. I'm going to share just a couple of things because I'm not going to get to every question that was asked, but I did want to highlight a couple of things for folks just as additional resources. I think along the way, someone was asking more about, you know, what were the waivers and flexibilities you experienced during COVID-19? And I know that Duke in particular mentioned some of them. We have a report at APHSA that we did with the generous support of the Kellogg Foundation, really looking kind of real time at some of the waivers and flexibilities and what they meant for states, and also starting to look forward to what those might mean for the future. And so when I turn it over to Gary, or if one of my team members is able to, we'll put that back in the chat so folks can link to that report. I think it will be helpful. There was also some further questions. Jody mentioned the Human Services Value Curve, which has been really an orientation or a lens that for almost a decade now, or about a decade, human service leaders across the country have been using to really think about this orientation from what we might describe as a very regulative system that is about compliance and you know, and just meeting outputs, to how we have a much more generative conversation that really is family and community centered. And we have some resources as well on our site about how that could be a helpful lens. And I think what is really interesting to me is so many leaders who've been in the space have really embedded that in the way that they're thinking, that we talk a little bit less about it as a thing, the Human Services Value Curve, and it really is the orientation. How do we orient ourselves to really be about having generative impact, which brings all of these pieces together, talks about the partnerships that you really need to create it, and flips your thinking, right, from I'm delivering this set of a particular program to the systems level of work and how you actually create that. So with that, I want to thank Duke, Antonia, and Jody for a really robust conversation, Terry for kicking us off, and I am going to now turn it over to Gary Glickman, who's going to share a little bit about what's next. But thank you so much to our panelists. That was absolutely terrific. Gary?
Thank you, Tracy. And I also want to thank Jody, Antonia, and Duke for participating in this. This has been a terrific panel. You guys have been able to articulate a lot of the themes that we've been thinking about. And when I say we, in addition to having worked with Tracy many years over the past, I chair the standing panel on social equity for the National Academy of Public Administration. And we've been fairly active in trying to look at what can we do to help move toward a more equitable society. And so before I get to the next steps, let me just share a couple of observations from this panel. One is, there's a number of words I was trying to keep track. I didn't keep count, but words that kept coming up: complexity, compliance, innovation, investment, holistically. And when I think about those words and the purpose for which we're doing these series, as Tracy mentioned, which is to try to highlight to a new administration, maybe there are some areas that can be looked at for improvement. I've come up with really 4 areas. The first is a redesign of, as Jody put it, the institutionalized patchwork of programs. And I think Duke stated as well as needing to look at holistically all these different programs and figuring out how can we provide not just support, but a pathway for people who have been left behind. And so that's one key area. And looking at that from the standpoint of innovation and flexibility, and really, I think Antonia, you put it, looking at systems that build families, not maintain their status, the supports that currently maintain their status. So that was the first one. The second one is really looking at a wholesale redesign of the grants management process. I mean, this process, and I had the opportunity to work in the past, not the last 2 administrations ago, at grants management. And this whole process of grants management is built upon a mistrust between the various parties. And every time there's a problem, we add another accountability item versus looking at, well, what's the real problem? What's the magnitude of this problem? And looking beyond a zero tolerance mentality. And that grants management process filters down to the faith-based organizations and others that we're talking about that really help. And so looking at how do we move this from a compliance-based system to an outcome-based system and demand accountability on outcomes, not on how many pencils you've bought and the minutia of how we manage grants today. The third area is really building a social infrastructure that creates pathways to equity. And so what I mean by that, Duke talked about this at various times, is the need for investment. When we talk about infrastructure, every administration talks about these huge infrastructure bills. They're going to fix potholes, fix bridges, things like that. What we need to think about is a social infrastructure that builds pathways to equity and the bridges to equity, in addition to just the hard infrastructure that we normally talk about. And that would include some of the other parts of the holistic approach that we look at, not just human services, but health, transportation, mental health, childcare, substance abuse, and all the things that have been talked about today. And then the fourth one, I think Duke probably put this most eloquently when he said we need to spend more money. What we need to really look at is we spend a lot of money, but are we spending it right? Are we getting results? And Duke has done a tremendous job in his state, I know, of looking at data and evidence and trying to build toward more equity through evidence. And we need to continue that, emphasize that, and also look at how we spend that money to get back to that whole, the redesign of the institutionalized patchwork. Jody, I love that phrase. Thank you. I'm going to keep using that. So what's next is that we intend to continue these discussions. And in addition to APHSA, we also want to link in some of the other sectors to try to get to more of this holistic view. So looking at the patchwork of criminal justice systems, healthcare systems, housing and transportation systems, it's going to be impossible to solve an equity issue if we look at it from the silos that are currently existing versus a holistic approach, as you've all talked about. You know, one thing that COVID has done is it has highlighted how the disparities have affected communities, but it's also highlighted how the communities themselves have systemic inequities that need to be solved. And so you look at, I think it was Antonia, that said that they're providing tutoring services at the local level. That is so important. But in a wealthy community, it's taken for granted. So why is that? It makes no sense. It makes sense that the communities are the ones, and Antonia, I commend you, because from my work at the federal level with Tracy and others, I think we need a rule, and Duke, you fit in this, that anybody that makes policy at the federal level that influences local practice needs to have worked at a local practice first, because there's just too much of a disconnect between what we think is right versus what really works. And so we're going to continue this series. We're going to expand it. We're also going to, we're in the process of planning right now our Social Equity Leadership Conference in June. It'll be early June. And this is going to be a major topic of discussion of how do we integrate all these different resources, what suggestions do we have, and trying to get more participation possibly from the new administration in meeting these new challenges. I know you look at the executive orders that have been issued, especially the ones on social equity, there's a tremendous commitment toward this. And so now it's a matter of how do we actually implement it to make change. And then the last thing I'll mention is that we are, and Duke, I'd love to talk to you more about this, within NAPA, within the Social Equity Committee, we are trying to create a framework that will allow for consistent assessment of social equity impacts across a number of different programs. And the purpose of this tool that we're trying to create is, first of all, at the federal level, to give them a way of implementing it through more executive action, but also to have more of a consistent voice across state and local governments, as well as other practitioners, so that they have a tool that they can look at and use as they see fit in their own communities. And so we're launching that, and hopefully we'll be hearing more about that shortly. So thank you, Tracy. Thank you, Jody, Antonia, Duke, and Terry for supporting this effort. And I look forward to seeing all of you in the future. Tracy?
Thanks a lot, Gary. Thank you, everybody, for joining. We will be sending out a link to the recording to everybody who participated. And just thanks again, and have a great rest of your evening. Bye-bye.
Thank you. Bye-bye.